When to suspect liver disorder. Introduction. India is ranked the third most obese country in the world and has a prevalence rate of 40.3%. An estimated 20 to 30% of the adults have excess fat in their liver that manifests into hepatic manifestations, including steatosis and progression of fibrosis. In individuals with chronic hepatitis C, obesity is associated with inflammation, insulin resistance, and non-response to treatment therapies that are further associated with idiosyncratic drug-induced liver injury. Clinical findings. Since the prevalence of the liver disease is very high in both the Western and Eastern world, several clinical studies have been conducted to find key relations and factors associated with them, such as a study noted that NAFLD is the most common cause of incidental liver function test abnormalities in primary care, 26.4%. 295 subjects out of 1,118. 7.6% of NAFLD patients are suspected to have advanced fibrosis. Another study based on the primary care of diabetes showed that the basal insulin level in persons with NAFLD at the stage of steatosis and steatohepatitis were significantly increased. Hence, the risk of developing clinical and laboratory signs of steatosis and steatohepatitis in non-alcoholic fatty liver disease was predicted. While study for communicable hepatitis infection shows that clinical manifestations depend on the age of the host, less than 30% of infected young children are symptomatic, while about 80% of infected adults manifest severe hepatitis with remarkably elevated serum aminotransferase. A study conducted by Telegdi et al. Provides further information by demonstrating that in all 58 cases of hepatitis, a mean 3 weeks delay of anti-HCV IgG ortho positivity was observed after the first manifestation of hepatitis. 70.6% relapsed and chronic hepatitis developed in 37.9%. 7 patients died of hepatitis. Thus, concluding that simultaneous evaluation of clinical picture, laboratory markers, and morphology is necessary to select cases for therapeutic trials. Another problem that people need to be warned about is self-medication and unwarranted dietary supplements, as a study using in silico models showed several anti-infectives for systemic use, and musculoskeletal system drugs were a cause of hepatotoxicity and drug-induced liver injury. Another study during a pandemic associated COVID-19 infection with drug-induced liver disorder. Also, it was found that patients with pre-existing conditions had elevated levels of bilirubin, alkaline phosphatase, and transferases after the treatment in comparison to normal patients.